Natalie Josephson, and I'm the Marketing Content Strategist at Regional One Health. And today we are very lucky to be talking with Amanda Williams of our Certified Nurse Midwives, who sees patients at the new Kirby Primary Care Office, as well as our Hollywood Primary Care Office. And our nurse midwives also help patients deliver babies here at Regional One Health. So I'm going to be talking to Amanda about what she does, and I'd like to start out by, I guess, getting a little bit of your background, Amanda. Tell us what brought you into the field of midwifery. What got you started?
Yeah, good morning. So I have always wanted to take care of women, right? And so I was really lucky. I've been practicing as a nurse in Memphis for like 16 years. I was in labor and delivery at Methodist South, Baptist DeSoto, Methodist Olive Branch. I just kind of, it's a small community. We work everywhere, that kind of thing. And so I finally hit a point in my career where I wanted to be more proactive. I wanted to be the provider, right? So I went back and I actually got my master's degree. That's how you become a nurse midwife or a nurse practitioner, as you are master's prepared and now doctorate prepared. Most programs are doctorate driven. And then I came home and I was a midwife. And Regional One is spectacular because they're an academic setting. And so they're just really creative with the way that they have organized their care provider system. We are essentially a hybrid. And so we have maternal fetal medicine, we have generalists, we have gynecologists, we have midwives, right? You get the full spectrum of care, and we all work together. So we provide this really amazing assortment of options for our clients, I think. And so I was lucky to be a part of that, and done so now for 4 years. I actually just finished, my anniversary was last week. So yeah, it's been really fun. And I've always worked with the Memphis population, so it's not unusual for me. It seems very much like my hometown, so.
That's awesome, and congratulations on the anniversary. That's exciting.
Yeah, thanks.
So you obviously have been seeing patients in this community for a long time, and of course, for the past 4 years as a nurse midwife. I'm sure you've heard it all from patients, but one of the things I know that you and your practice hears are a lot of misperceptions where patients don't exactly know what is a midwife.
Sure.
Tell me some of the, I guess, the misperceptions that you hear, and then tell me what you actually do as a nurse midwife.
Yeah, okay, great. Yeah, I love the myths and legends of the midwife. Yeah, so when they first come to the office, they always assume I'm a physician, right? Even though I don't wear the white coat, because I'm always fighting that struggle anyway, because I am not a physician. And then they go, well, what's a nurse midwife? Are you catching babies at home? And I'm just like, well, no, you've come to my office, my clinic, as you can see here, and I provide all kinds of care, right? There are nurse midwives who attend birth at home. We actually are really excited here in Memphis. We have a nurse midwife group that's going to be at a birth center as well. So Memphis is coming along, but yeah, no, specifically, I'm a nurse midwife. I am master's prepared. I attend births at the hospital, but not only that, I provide well woman care, like annual exams. I treat STIs. I prescribe contraception, like birth control pills, the patch, the ring, the IUD, all of it. I also can treat any issues you have medically, right? Like I said, I'm not a surgeon, but if there's a medicine for it, I can prescribe it for you. From the time, you have your menarche, your first period, to the time that we pop the champagne cork and say goodbye and good riddance, we can take care of you, right? So yeah, that's the biggest thing is they're like, are you a doctor? You're not a doctor. What in the world are you? And so I oftentimes talk about nurse practitioners. That's a more common term, I think, people are more familiar with. And so we are nurse practitioners. We just have a specialty. And it's a really cool historical term that we don't want to give up. So that's the biggest thing. And then the other piece of that is, can I have medicine if I have a midwife? Does that mean I have to go what they call natural, meaning no pain medicine, lolling on the floor, just, very, very primitive, right? That is not the case. You get evidence-based medicine with midwives. I think even more so because we pride ourselves on that. We want to make sure that if we are offering services, there is a very good reason, and we've communicated that to you effectively, because that's what informed consent is, right? And so we want to make sure that you have a full understanding of the care you're receiving and you're getting up-to-date, American medicine. So if you have an epidural, great. If you don't, that's great too. That's the whole point, is that it's your journey, it's your show, and we're providing appropriate services to match your expectations. And so that's the biggest thing too, is, we also have really cool tricks though, that maybe you don't need an epidural because we have you up and walking, and, we're doing all kinds of like birth gymnastics. And so you're not just strapped in the bed hurting, right? Which is another American tradition. But yeah, what else? They're surprised I'm not super old, right? They're surprised that like, oh, if I don't have 15 kids of my own, like, how are you going to be a midwife? That kind of thing. Midwives come in all shapes and sizes, even people who identify as men, right? Because midwife means with women. It doesn't mean I am a woman. So it's really cool to see just the community of midwifery grow and represent all walks of life and all people.
So I can tell from what you've just said that, it's important for people to know that you take care of women of all ages, all stages of life. Let's dive a little deeper into what you provide to those women. Maybe starting with a very young woman, a teenager even, and tell me a little bit about how you would care for that patient and what she can expect when she comes to see a nurse midwife.
Sure. So a younger woman, you're trying to provide a good knowledge base, right? Oftentimes, they can come in as young as 11, however early you get your cycle, right? And they want to talk about what's normal. Is this okay, right? So a lot of reassurance, a lot of information about what a normal menses looks like. And really, again, listening to them, seeing what's going on, should we address it, right?
Then what that woman can expect, the woman who is trying to get pregnant and then does get pregnant and wants to have her baby with the midwifery practice.
Sure. Yeah. So in your early 20s and 30s, we start talking about making sure you're doing your annual well care, right? Getting your pap smears, your gyne care every year, so that you are healthy, right? We talk a lot about at those appointments about making sure you are well nourished and you are exercising and you are, at a healthy weight, and that things like that. You're not smoking, you're not drinking, and all that kind of stuff before we even get pregnant, right? We do these preconception appointments where we can even start on prenatal vitamins, right? And then once you come in with the pregnancy test, and it's positive, the way you address a woman should be where she's coming from. Not everybody comes in happy that they're pregnant. Some women come in ecstatic, some women don't, some women are shocked, and so you always ask when they first come in, I'm like, oh, this is me anyway. I hear that you're pregnant. How do we feel about that, right? And so you wanna make sure that they direct the conversation so you can provide them the appropriate services. Then we provide full prenatal care. We see them for several visits through their pregnancy. Again, lots of education, lots of information about how their bodies will change and what to expect, and precautions they should take. And then we also attend their births, right? Like I said, I don't deliver folks. I'm not a pizza person. I attend their birth, this experience they're having. And so I'm lucky I work in a group of 6 of us. And so you never have to have a tired, angry old midwife that hasn't been sleeping for the last 10 years. And we make sure that you will meet every one of us at your prenatal appointments. So we're sort of like a squad mentality. So whoever shows up, you've met them before, we have a relationship. It's not this space where you're vulnerable and you're just meeting strangers, right? And then of course we take care of you afterwards. through your postpartum period. And we actually see you a little bit more frequently in your postpartum period than traditionally, because it's such a vulnerable space for the first 6 weeks. We don't just wait until whatever happened to you for 6 weeks, and then we see you and we talk about, oh, well, I guess you survived it or whatever, you know, because there's a huge issue with like postpartum depression and coping and making sure women are well resourced socially and, you know, that kind of thing. So you just want to make sure you don't just catch your baby and disappear from their life. And so that's really important to us as well, that continued relationship. And so I'm very proud of the fact that we have women who like return to us from multiple children, right? Because we're just back at it again, they'll say, and so good to see you and that kind of thing. So it's, it's a really special relationship that we have with them, I think.
That's wonderful, and wonderful to hear that you're by their side even after that baby is born, because that is a difficult time in a woman's life, a happy time, but a difficult time.
Well, right. You talk about, well, I don't mean to cut you off, but that's a big thing. We talk about like this sense that women are supposed to be ecstatic, you know, I just had a baby, nothing can touch me, you know, I'm invulnerable and super excited. That's not the case. Even good stress, even if you are happy, it's still stress. And so learning how to cope with that and making sure that you're coping well is very important. So yeah, that's all I want to say, because yeah, there's this whole mentality of like, oh, at least healthy baby, healthy mom, and everything's fine. And so we find a lot of women do hide the fact that they struggle because of that expectation.
Absolutely. And it, you know, just to dive into the, you know, the pregnancy and postpartum aspect of this a little bit more, you know, it sounds like you are very careful to treat every woman as an individual. You mentioned, you know, you have women who have different emotions about being pregnant in the first place. And then, of course, different emotions and different situations as they go through their pregnancy. And then after they have that baby, how do you make sure the care you're providing is specific to the woman herself and what she is going through throughout her pregnancy and after she has the baby?
So they always tease midwives because our appointments go super long, right? And a lot of that is because we are having a conversation with our patients, right? Instead of popping in and being like, any problems? Let me check your belly. Okay, see you in a week or whatever. It's more of, I make a point to sit down during my appointments and I say, tell me how it's been since your last visit. Tell me what you've been going through. Tell me, you know, anything. Tell me anything you want, including any weird dreams you're having, right? And we ask all the appropriate questions to make sure they're physically well, but also emotionally and mentally well. And again, especially here in Memphis, we work really hard to make sure our girls are, I say our girls, that's demeaning on me like that. I just mean like our folks, our neighbors are well socially resourced as well, right? Because if she has no place to live or her electricity is cut off or she struggles to find food because we have food deserts, then that's a big deal. And so we don't know that though, unless we're having that conversation about what's really going on in her life. And so that's why our appointments take a long time, because we are listening to women, right? We are learning about them. We are getting to know them. We have this relationship where she knows she can tell me anything and I'm there to help. It's not, you know, she's not just another patient for me. Is my hope anyway.
That's wonderful. That's wonderful. And so, you know, kind of taking that, I guess, to the next stage of a woman's life, you've ideally by this point, you've built this relationship with your patient through starting at a young age, through her pregnancies, if she decides to have children. And then your patient is moving into the later stages of her life. She's maybe starting menopause, getting older, needing those breast cancer screenings. Talk to me about the care you provide and what a woman can expect as she moves past her childbearing years, so to speak.
Right. So it's a lot of preventative care, and then it's a lot of information about the upcoming expected stages, right? I don't know if anybody else felt this way, but when I turned 40 and everything started to kind of crumble around me like a haunted temple, I was like, oh, I didn't realize at 40 I was supposed to feel, you know, hot flashes or, you know, I thought that was an old lady thing, right? But, and because we don't talk about it. We don't talk about things like that. And so every appointment with us should be information about and what we call anticipatory guidance, right? Just, hey, this is what you can kind of expect. Hey, is this what's going on? And I think oftentimes a lot of women feel symptoms of things that they dismiss because they're so busy raising their children or taking care of their parents or working themselves to death. And so they'll dismiss the way that they feel physically and won't address it. And so we oftentimes take that opportunity when we have them there in the clinic, either for their well woman exam or if they come in for a problem exam, to say, what have you really been going through, right? Like, give me a full list of like what your life looks like and, you know, what's going on with you. You know, if you are working, say you're working like, you know, 40 plus, you know, 50 plus hours a week, smoking half a pack a day to get through it, maybe drinking a little too much. I mean, you gotta think about like what's really going on in this woman's life. And so it's still that same level of communication. It sounds like, or nosy aunts or something like that, but it's just really important because oftentimes, like I said, women will put themselves second, right? And so when they're there, we got to make sure she feels center stage, and I want to know everything about you, everything you need, so we can get you covered, right? And then of course, like I said, a lot of preventative care, like making sure they take that time to go get the mammogram, you know, make sure that they stay on schedule in terms of like, if you still, you know, need contraception or you need cycle control, we still use contraception for cycle control, you know, because again, once you hit 40, everything gets kind of a little bonkers, or can anyway. So we just want to make sure that these women still feel center stage at their appointment, right? That they're not just being like, well, I know my joints have been hurting for the last 6 months, but you know, I think I'm just kind of tired, right? So, but if you don't sit down and have like a real conversation with her during her appointment, you're not going to find that out.
No, absolutely. The more you can build that relationship and talk to the individual patient, I'm sure it helps you provide better care, right?
Right. And so that's a huge issue in healthcare, right? Is balancing volume, right? We still have to keep the lights on with like good quality care. So we have to make sure we have that good balance where we're still seeing enough people as appropriate, but we're giving them good, solid quality experiences when they're there.
So then, you know, obviously the woman, she's with you for a small period of time, and then, you know, she walks out of your office and goes back to living her life. What are the tools that you're giving these women to, you know, really kind of empower them to, once they are not in front of you as a patient, to take better care of themselves and lead a healthier life? How do you kind of prepare them for just, you know, getting through their life in the most healthy way they can?
Oh, right. I don't know. It's so hard because you want to, you know, just as you can tell, I like to talk, right? So you just, you know, try to make sure that they're well resourced. I know I keep saying it over and over again, like it's some magic term, but it really is meaningful in terms of like emotional and physical resources, right? So you want to make sure that she has everything she needs in terms of sexual health management, right? And then we also talk about just everyday stress. You know, how do you live your life? Are you eating the things that will keep you healthy, or are you just eating like your kid's scraps off the plate or fast food, right? Because you're busy. You know, are you well hydrated? That is, my clients will tell you that's the biggest thing I brag about, is like, you have to drink water. It's my cheapest medicine, I promise. It does wonders for you, right? And we're also just desperately underhydrated, I think, particularly in Memphis, because we're always a little sweaty. Yeah, and then beyond that, just making sure that they feel comfortable coming back to us, right? If they do have a problem. Instead of like, okay, well, I did my annual exam, I'll see you in a year. If something comes up, even primary care, right? Like they start to have some sort of physical symptoms, they can still come back to us and we can get them the care they need. If we can't provide it, we certainly have a massive system of providers that can certainly assist them. Even in the primary clinics, right? We're super lucky. We have not only nurse practitioners and physicians who offer primary care, meaning like the sniffles, cough and cold, blood pressure, all that kind of cool stuff. We also have pediatricians, right? So we work as a full service for the family. And that's the other piece of it, right? You want to make sure that she feels comfortable asking questions about her whole family's care, right? Not that we should be talking about grandma and grandpa and that kind of thing at her appointment, but just, you know, if she has concerns about how they're like living their life, you know, then she can bring that up during her appointment. Because again, it's that relationship piece.
Definitely, definitely. So you know, you've mentioned a little bit about how we're working in a large healthcare system like Regional One Health, where there are these other providers that you team with, you know, is yet another benefit to the patients you see. Tell me a little bit more about that, not only in the, you know, primary care, well women care aspect of it, but just, you know, also for a woman giving birth, why is it beneficial to be able to do that at Regional One Health? You know, if a woman needs imaging, anything along those lines, how does it help that she's seeing you and building that personal relationship, but she also has this large healthcare system behind her as well?
Right. I mean, because we offer this like pyramid of services, right? And everything is in a central system. So we all share the same information, right? So whatever I put into the system, the next provider will be able to see. And so their care is centralized instead of piecemeal. You know, it's like I saw this dude and this lady and this person over here. And in those kind of situations, you can never come together to see the full picture. But in our system, we can do that, right? Because everything about her is centralized in this communication electronic record. And so I'm very fortunate. Just as an example, I have this lady who came in and she had a baby with us. However, she needed what we call a vacuum assisted birth. And so I am on the unit 24/7, right? With physicians, with surgeons who are there that can assist me with what we call an operative delivery at that point, where we assist with the birth. You know, it becomes necessary to intervene, right? And so Regional One is set up in such a way that all these extra services are at my fingertips. And say this woman had a vacuum birth, right? So afterwards, I'm going to want her to have pelvic floor therapy, physical therapy. And we have this amazing woman, Miss Dariana Butler, who is just a pelvis guru, right? So I can send her right over to that clinic, and it's still within the system. And she knows everything about her. She knows what the delivery looked like because, you know, we make a huge note about it. And she knows everything about her history because we did, you know, 40-minute interviews. And so she steps right into her care. And like, so we work as a team to help this woman, right? So that's kind of a dramatic example, I guess, but I mean, we're just very lucky. I like it. And the fact that I can call Miss Butler, right? Like I just call her up on the phone even, you know, I mean, because that way that we all work so closely.
Right. No, that's fantastic. Because I think one of the most frustrating things to a patient is having to explain what's happening, you know, 15 different times before they
Right.
get the they need. You know, I guess looking at it a little bit more from the patient's perspective, when a patient decides to come to you all to come to the midwifery practice, what are some of the things, you know, maybe she can either do or keep in mind to make sure she's getting the most out of her care from her nurse midwives?
Let's see. It's hard
Sorry
to
to put you
like,
on the spot.
no, that's okay. It's hard to not answer it like from a personal perspective because I know I'm pretty type A, right? Yeah. So you always want to make sure they feel comfortable asking questions, right? So make sure anything you've read on Google, anything you've heard from, you know, your mother, your sister, or anything like that, bring those questions in. You want to make sure that you feel comfortable sharing personal information with your provider. Feel like you can actually share without having it feel like a confession, right? I'll find clients will not tell me things because they're afraid of being judged. And so that's been the biggest part of our communication issue, is making sure that women feel like they can tell us their sexual orientation, their gender, their, you know, lifestyle, without judgment, right? So that's the biggest thing, is just be prepared to be your best and most honest self with me, because I'm not there to judge. I'm there to make sure that you are safe and healthy, right? And so we'll gear our communication, our care in that way.
No, most definitely. You are you're their partner in care. You're not there to lecture them or dictate to them. And I think that's another thing that maybe is important for people to know about midwifery. I know you all have said you take pride in not telling a patient, this is how it's done and this is what you're going to do, and I'll get it done for you. You take a little bit of a different approach. So tell me about that.
Oh yeah, the worst thing in the world you can say to somebody is it's standard. This is what we do. Right? You're like, so just because you've always done it, that's the thing we're going to do? That sounds terrible, right? Everything, like I said, everything we do, it should be evidence-based, right? It should be for a reason. And if we cannot give you a good enough reason for it, in terms of how you're interpreting the situation, then we don't do it, you know, within reason, right? Hopefully I've given you a good enough reason for us to do something. That's why I talked a lot about informed consent. Informed consent is not, here, sign this form, I'm going to give you treatment. I know what that treatment's going to be. I know the risks and benefits of it, right? But I don't thoroughly explain it to you, but you've signed this piece of paper, now I get to do what I want. That's not the conversation. The conversation is like just signing consents for birth, right? I talk about this covers any type of monitoring we're doing, whether it's continuous or intermittent, whether or not we have to do any kind of laceration repair, if there has to be some sort of intervention, what those would be, like I said, the vacuum or some other, you know, heroic emergency thing. And we also talk about like what kind of medication we may use, right? We all love Pitocin in obstetrics, but you want to make sure that you're explaining to this woman, if she chooses to augment her labor, what that means in terms of how it will make you feel, what it actually does. These are the consequences of using it. And so she can make a real informed choice about the care that she's getting. And like I said, if I give you a good enough reason for it, I'd love you to do it. But if not, then it's a service and you say no. But that way you're fully informed, right? I hear a lot from women who are like, I don't even know what they did. I didn't realize what kind of medicine I was getting. I didn't know anything, just because stuff was done to her, right? Instead of for her. And so a lot of that is that disempowerment you see in birth, where they feel like they were just an experiment that stuff was done to, as opposed to giving birth and being cared for through that experience. And so, it sounds so like, I don't know, sounds very modern, I guess, but those kind of conversations are really important, you know, making sure she still feels like a person and not just a vessel or, you know, a piece of meat.
Right, exactly. And
Yeah.
I know that's a philosophy that's shared throughout your midwifery practice. Tell me a little bit more about, you know, the team approach that you all take, your fellow nurse midwives at Regional One Health, and how you all kind of share a philosophy that allows you to take care of these patients as a team, as their healthcare squad, as you've said.
Yeah. You know, coming up as a nurse, I saw a lot of private practice physicians. Burnout is so real. These people would be on their like third marriages. They never see their children. They don't take care of their bodies because they're just a one-person show, right? For 30, 40 years, you know? And that kind of mentality where you don't take care of your providers, that's how you get poor care, because then you're just trying to survive, right? And so for us, it was very important that we had life balance, work-life balance. So we wanted to be well resourced in terms of having enough providers that we could work as a group, because we do cover the labor and delivery unit 24/7. Anytime you call up there or come up there and say, I'd like to see the midwife today, we're there, right? And so to provide that kind of constant service and still have clinics, we had to have enough people to do that. And so it was very important for us to do a group, because we, some of us still have children that we'd like to see occasionally, or go on vacation, or be able to get sick and not feel like you've abandoned 30 patients, right? So I think doing a group scenario, even though it could be tough for some people because they have their favorites, right? And they just want to make sure they stay with their favorite. It's more important that we provide good care to our providers as well as our clients. And I think that's the way to do it. Eventually, all people must sleep, right?
We hope. We like to think that that's an option. Your team, I know you all recently expanded. You've started seeing patients not only at Hollywood Primary Care, but at Kirby Primary Care, the new location. Tell me how that's going, and how you've been able to serve this new community of women around our Kirby Primary Care.
It's really great, actually. We are very lucky. We have an amazing nurse at Kirby too. We have an amazing nurse at Hollywood, but the nurse at Kirby also just spoils us to death. So it makes it like super exciting. But also we are next to the Quince and Kirby location as well, which has a pharmacy there. That's been the coolest thing, I think, about the expansion that we're doing at primary care, is having pharmacies available to our clients as well with discounted prescriptions, right? And so we can provide this extended service to them. And it's made everything so much easier. I don't know, it just does, when people just can easily access care, right? And I think having a presence out east is just as important as having it in the north and south of Memphis. That way we can treat our whole community, right? And we offer such unique services that it would just be a shame not to give them a chance, right? So it's been really fun. It's been really great.
That's great to hear. I know women are excited to have you guys over there. I guess, to kind of wrap it up, sum it up a little bit, you're looking back at 4 years at Regional One Health. You said you just had your anniversary, and years before that of serving patients in the Memphis community. What has been, just most rewarding and most fulfilling to you about what you've been able to do as a certified nurse midwife for patients in our community?
I think, Memphis has an issue with, it has a lot of issues, frankly. Poverty, infant mortality, we have issues, a lot of health issues in our community. And so it has been really important to us that we address them. We address health disparities in our community. But the other piece of that, I think that's been super important to us, has been our influence on our physician population. Because like I said, we are an academic facility as well. So we're training future physicians. And so normalizing birth, normalizing physiological birth, and normalizing working with nurse practitioners and nurse midwives has made a huge impact on healthcare in general, I think. Because we train physicians to cure things, right? And they're so good at it. But there's that other piece that a nurse practitioner or nurse midwife, since we're a hybrid, that piece of like, being able to educate, being able to people a little bit better, right? Having that in the community, in that training center has been very impactful, I think. And our residents say that all the time, oh, I would never have thought of that, or I didn't realize, just because it's another way of looking at providing care. And so I think for me, that's the most exciting, because that means that it's not just this special unicorn, one person who does it. That means we're changing our healthcare system, right? And so we're getting that good quality care across the board. I don't know, that's a little saccharine, I guess, but it's super exciting. Like I said, I'm really proud of what we're doing there. And so I can't wait to see what the future holds.
That is great to hear. And it's not saccharine. It's it's the fact that you guys really care about your patients and, try to give them the best, most educational, empowering healthcare experience that you can. Amanda, is there anything else you wanted to say specifically about midwifery or about what you all are offering to our community?
Oh, yeah, I think every woman deserves a midwife. I think everybody should come see us. And if you need higher level care, then we can get you that kind of care. I just think that every woman deserves a midwife. So that's what I would do. I would hire 6 more of us, and I would open 3 more clinics, and I would make sure everybody in Memphis could come see us for a variety of issues, right? Like I said, most importantly, preventative care, and then any kind of medical treatment you need, any kind of contraception needs you have. If you need STI testing, if you just want to talk about what it would mean to get pregnant, then yeah, you should come see us.
I think that's fantastic advice, and we hope more patients in our community will take Amanda up on that. Amanda, I just wanted to extend a big thank you to you for taking the time to share about our midwifery practice and what you all are offering at both our Hollywood primary care location and our brand new Kirby primary care location. And for anyone out there who is interested in getting involved with this really special, personalized, empowering type of care, you can get a lot more information and details about how to make an appointment at regional1health.org/midwifery. And just to say that again, in case you missed it, it's regional1health.org/midwifery. Check it out.
We all have profiles on there, so you guys can read our profiles and kind of get to know us before you come in. We have clients do that all the time.
No, that's wonderful, and it's a great team of nurse midwives, and you've gotten to know Amanda a little here today, and her colleagues are also fantastic. So check it out, and hopefully you can get connected with our nurse midwives and find out just how fantastic they are at providing care for patients. Thank you again, Amanda. This has been really informative, and we really appreciate you taking the time to do it.
Oh yeah, thanks so much. I appreciate it.